Sometimes I feel like it's kind of third world medicine in a way, like going out into the field, you don't have every single thing you need, and you do the best for that person that you possibly can. I think that's okay. Because, frankly, if I wasn't doing it, a lot of these people would get no care, and they would just show up at the ER in a total mess. This is for you, and that's for your bear. I'm not going to give your bear real juice.
It would get dirty and smelly and ew.
No, he can just pretend to drink juice.
Ailey, 8 minutes.
I know.
Bye. Later, Gator. Hi, Roger. How are you? What's going on? Where's your pain today? Your back. Is it kidney stone pain on the left? Yeah. Because I got that ultrasound back. I just got those ultrasound results today, and there's quite a few kidney stones in the left. Roger Brown is a 30-year-old man with Duchenne's muscular dystrophy. He was diagnosed when he was 4 years old, and I think by the time he was 6 or 7, he was in a wheelchair. He was able to go to the prom in a wheelchair with his girlfriend.
I don't know if you know much about Duchenne's muscular dystrophy, but it's a progressive muscle disease. It deteriorates the muscle until there's nothing left, and then it starts on his internal organs. Right now, he needs a respirator, but Medicaid don't want to pay for it unless he goes in a nursing home for 30 days.
How's your breathing been? It's been good. It's really the pain that's getting you down. Right now, his heart is in heart failure because it's a muscle and it's not working anymore. His ejection fraction is at about 20%. So fluid builds up in his abdomen and in his extremities. I'd like you to increase that Lasix to 2 and 2. 2 and 2. We've got a delicate balance here because he needs fluids for the kidney stones, but his heart can't take too much fluid. It does suck. We had a really wonderful and sad conversation last week about end-of-life care, what he'd like. And he told me, I want to do what I have to do to live as long as I can. I want to prolong my life as long as I can until I tell you that I don't. And when the pain is too much and when my breathing, I'm struggling too much, I'll let you know. But I want to live for as long as I can. And I think that's completely reasonable for a 30-year-old person. Try the extra pain medicine, a little bit of it. Okay? Like, try it. I know you don't like pain medicine. I think you're the only 30-year-old who doesn't. I mean, the average length of time when someone's on this kind of service is 2 years. So, you know, I'm gonna watch or be with families as they transition into something else, whether that's death or a nursing home or whatever. And I would say, I mean, on the average, at least one of my patients is dying a week. And if I let myself go there every time, I won't be able to do this very long. Today I'm here to see Pat and Wink Sherrill, a married couple. They've lived in this apartment for, I think, 27 years.
Well, I ain't been camping in my life, and I don't want to go. Not no woods. I'd be afraid of snakes and spiders and everything else.
We're looking for a good shelter spot.
Well, I was born and raised in Kentucky, Campbellsville, Kentucky. And I stayed down there until I was about 18 years old. Worked on a farm. My dad had a farm. I left from there and I come to Evansville here, and I've been here ever since. I retired as a carpenter here 40 years.
I was born here, but I've been raised all over the country because my stepfather was in service. The only place we didn't get to go was Hawaii, because he died with open heart surgery.
They had been going to the same doctor for a few years. They felt comfortable there.
Well, the thing of it was, we was going to this doctor, and man, he pulled a thing on us.
Put a red flag on us.
He got in a bunch of trouble over doing a lot of people dirty.
They both take prescription narcotics for arthritis pain. And there are new laws in place where if someone takes prescription narcotics, they are required to take a drug screen at least once a year to make sure they're not using any illicit substances. Number two, to make sure that what they say they're taking is actually in their system. Because of course, diversion or selling narcotics is a growing problem. The street price of a narcotic, one pill, is like $10. Patricia took her drug screen and it came back negative for her narcotic that she was supposed to be taking. And that's a problem. At that point, he kind of justifiably discharged her from the practice.
One day he called me up when I had an appointment down there. Just called us up and said, well, I don't want to see you no more.
But in their words, they felt like they got blackballed when they tried to get another clinician, a physician or nurse practitioner in town. They got declined.
And he went and put on all the computers, put a red tag on all of the
I
people
couldn't get a
that
doctor
he
in this
didn't
town.
want to see.
Both of us.
A red tag on them for no other doctor would
There's
see
St.
us.
Mary's or Dignas or anything.
So they were unable to find someone to take care of them for about eight or 10 months, which is a huge problem because they have chronic health problems. But I don't feel like as a community we can just discharge people without care and then have nobody to accept them back into their practice. I mean, somebody's got to take care of them.
He said I was so clogged up.
You were clogged up, and so
Right
that was
here.
to get it.
That was the only problem I had by the colon. But he said everything up here was just fine.
Did you do that Miralax cleanse that he recommended?
Yeah.
That's even worse, isn't it?
Yeah. And I don't want no more of that either.
Okay. So you're cleaned out. I mean, you're clean.
I'm cleaned out.
So what I would recommend that you do is take a break from that pill,
Yeah, I am.
and then even take a break tomorrow. And then start with one every other day.
Okay.
Did he give you samples
Yeah.
of it?
My insurance wouldn't pay for it.
Right. It's expensive medicine.
Yeah, for 30 of them, $275. No, I don't think so.
The issues going on with Wink are that he just had a prostatectomy, a prostate surgery for prostate cancer. And then he's got all the run-of-the-mill chronic conditions that men who are in their 70s tend to have: high blood pressure, high cholesterol, arthritis.
8-10 years ago, Crohn's disease hit me. And then I had to have a surgery done over that, and I had to have my lower colon, part of it removed, upper colon removed, part of it, and a tumor took out my stomach, just a little bit of everything. And it just put me down. I had to retire.
All right, Papa Wink, what's going on with you?
Well, first thing is I got a sore stomach.
Yeah. I'm gonna press a little bit, okay? I'm gonna start way up here.
Okay.
Are you hurting there at all?
No.
I'm coming over here. How about up in
Just
there?
a little sore right
Little
there.
sore there. Can I see your tummy, just the skin? We don't.
Yeah,
We probably
sure.
won't. Have to. Okay.
You can see where it's been cut.
But you don't think it's your colon? You think it's from the surgery?
Well, I don't know. It could be my colon too.
And you had cancer on that
I had
left
cancer
gland.
on that. Whatchamacallit, they took out. They got rid of all of it.
Got rid of all the prostate cancer.
Yeah.
Did you have bladder stones?
Yeah.
Yeah.
Yeah,
Okay.
he went in my bladder and took them out of my bladder.
Okay.
But they went up the other way.
Right. Well, I'm so sorry that it's been such a hard recovery.
Well, I know it.
Yeah.
And y'all are such good people.
Well, you're a good person. It's easy. It's easy to be good to you.
Y'all have been so good and nice to us. We don't know how to thank you.
Well, you don't. That's my job,
I know.
and I enjoy it.
I know.
I'm not naive. I know anyone is capable of anything, but I'm just keeping a close eye on it. I don't believe that they abuse their pain medicines. I don't believe they sell them. I believe they both need them. You think you're getting a little depressed?
I may be.
I think so. Did you know that when you have depression, that your pain is worse?
Yeah.
Everything's worse.
I'm sorry about this.
That's okay. I'm so glad I'm here today, because oh my gosh, I didn't know.
So I sat here and I worry a lot about that.
You're worrying.
Yeah.
Okay. Ooh, boy, yeah. Sometimes you come and you have one complaint and you think that's the problem, and that's healing. That's not the problem today. Your spirits are the problem.
Yeah.
Yeah. Okay. Good thing is we can work on that.
But I don't give up.
No, you don't.
No, he don't give up.
No. Yeah. Too strong to give up.
There you
Yeah. Okay. I'm gonna come back in 2 weeks
go. Okay.
to check on you both, okay? But I'll make sure to get your medicines called in
Okay.
when they're due. But you're gonna get something for your nerves, okay?
Okay.
Yeah.
Depression.
Oh yeah. Yeah.
Get something for both of them.
Oh yeah.
Sure appreciate it.
Yeah.
Paintball?
No, it's a nerf, right? Mm-hmm. Can I have a hug before you guys gotta go? Okay, thanks.
I'll give you a hug. Where are you going today?
Evansville, Newburgh.
Good. How many?
10. I did have another person on today, but I always read the obituaries, and I opened the paper, and someone I was supposed to see today passed away on hospice care, so it was expected, but she passed away on Saturday, and I'm a little irritated at hospice because they didn't let me know. And then, you feel like an idiot when you show up at the house and no one's told you that they've passed away. I prefer to see 8 patients a day. That is my comfort level. Doesn't sound like a lot because when I was in an office, I saw between 20 and 25, but a lot of those were really quick strep throat or skin infection or something straightforward. All of these patients have multiple complex things going on. If your breathing gets to the point that you need a ventilator, then the 3 of us will have to talk about whether you want to go to the hospital or not, because that's the only way they're going to pay for it. My feeling is to think on it and cross that bridge when you come to it.
When do you think it will happen?
So hard to say. Right now your breathing is stable. And I do want to be real honest with you. I don't have your echo yet, but of course with muscular dystrophy, your heart is going to continue that muscle will continue weakening and not pump as well. So at that point, I'm not sure. There's going to be a delicate balance of what happens first. If your heart really gets sick, there's not a lot of common sense putting you on a ventilator, because that wouldn't keep your heart going. It would do the breathing for you, but it wouldn't keep the heart pumping. So as all this unfolds and plays out over time, I feel like the ventilator is less of an issue right now. Right now, it's your heart and taking the fluid off you so that it pumps adequately.
Is there any way that it might get a little bit better after the fluid gets off?
Your heart won't get better with taking the fluid off. No. You'll feel better because the fluid will be off, but it's not going to make the muscle any better. Which brings up my next thing I wanted to talk to you about. Medicaid. I might be able to find a Medicaid hospice service. I was talking to your caseworker about that. Once you get a person on hospice, it's this huge relief. You don't have to do things you don't want to anymore. You don't have to take medicines that give you bad side effects. You don't have to, go to the hospital. And hospitals, they serve a purpose, of course. I'm not anti-hospital, but patients don't sleep, they don't eat well, they're exposed to infections. I try not to push, but I want people to know that they can spend the last few months of their lives or weeks of their lives not doing unnecessary stuff, and just spend it with the ones you love. Keep your energy for that. So I wish we'd have more honest conversations with people about it. It's a really hard thing to do. I don't want to talk you into it either way, but I think hospice might be a good thing at the moment. And then we just have to take everything as it comes. Every symptom we have to manage and then make a decision at that point. How are we going to manage this one? How are we going to manage this one?
Do you think he will end up in a nursing home?
Unless I die, no. He's not going nowhere.
That's where he wants to be.
Mm-hmm. Yeah.
I think today, when I told him his heart's not going to get any better with medicines, it's just going to make him feel a little bit more comfortable. I think that might help them towards this decision that, we're coming to the last chapter of his life. I don't want to give a time frame because I don't know. Nobody knows. I think it's best just to keep him comfortable and at home where he wants to be. And I think if I can find a hospice that will take Medicaid, that's an issue, is a lot of hospices, or any agency for that matter, won't take Medicaid as an insurance. So finding that agency to do that will be a challenge, and I have one in mind that I really want to take care of him. So we'll see how he does next week. Hey, Ron. Good afternoon. Nice to see you. How you doing? Mm-hmm. Long time no see, huh? You got a good one. Mine like a steel trap.
It's been shook around
It's been shook around, yeah.
too much.
I always think he's younger than he really is. He's in his early 60s. I think he's 63. And I think when I started seeing him, he hadn't been into an office in a few years. His brother is an interesting character who hopefully we'll meet sometime. But you do pretty well, don't you?
I have so much more to do.
So much more to do.
Yeah.
You'll see in the house, there's a wooden chair that he made. So he wasn't so much a painter or that sort of artist, but I think he worked with like 3D, like ceramics and woodworking and sculpting. Then he went to California and got in a motorcycle accident. Health-wise, what's going on with you? Are you steady as a rock? Any complaints or concerns?
Well, I think I need to do something to make my muscles more muscular.
When is the last time you've done any kind of physical therapy? Been a long time. Okay. Now, if you're talking about your muscles, which you want more upper body strength or lower?
I think I need to talk to Mr. Balance.
Better balance.
Any.
And I will look into getting some therapy for you here in the home to see if we can get you a little bit stronger and more mobile and balanced. And that's going to be tough. You know, with a brain injury, there's going to be limits to what they can do, but surely they can make you a little bit better. Sound like a plan?
Super.
Okay. And I'll be back next month to check on you.
Oh my God.
And it's not time for lab work yet. Your lab work was all fine. Even your cholesterol was good. Whoop, whoop. All right, see you next month. Thanks. Oh.
Too long.
Okay. Keep up
Too long.
Keep up the good work, okay? I'll see you next time. Bye, sweetheart.
The good work. Oh.
When you're a nurse practitioner and you're not in a traditional office, this is the line people always ask me now. Well, what doctor do you work under? I don't know why that irritates me, but it does. I have a collaborator. I have someone who helps me in sticky situations, but I don't work under anybody's. There's this perception that you are kind of just like a little minion that's carrying out activities for a doctor, and I hate the hierarchical stuff. I just do. I hate the term physician extender. I hate the term mid-level provider. I don't feel like what I do is middle of the road care. I feel like it's really good care. I want to be called a nurse practitioner. But I do think that care happens best in a team. And I feel like what I'm doing right now works really well because I have a really, really good collaborator who is very willing to, he never sees the patients, but he listens to my clinical case. I tell him about it, and I tell him what I think I'm going to do, and then he makes suggestions, and I trust him 100%, and I think that's a good model, and I think that's where, if we want health care for our whole nation, we're going to have to rely on some nurse practitioners.
This week, he's been thinking about death a lot. And I've tried to assure him that you're not going anywhere right now, but I guess if I was in his position, I would be panicked too. When you have the DNR, they're talking about do not resuscitate, and have you made the funeral arrangements yet? And we're like, well, hang on a minute, we're not that far.
Hey, how are you? Thank you. Hi, Scrappy. All right. Do you have, spiritual or religious beliefs, convictions?
I do, but don't go very far.
Uh-huh.
Like completely, into some of it.
Mm-hmm.
Understand some of it.
Some of it. We're just so scared of dying, and so we're not honest with families about their lifespan or their loved ones or the patient. We're not honest with them that, you don't have very much longer to live, and that what we have available to you, we can do a bunch of stuff, but it's not necessarily going to change your outcome or prolong your life. Let me put it to you this way. I should have funeral arrangements made. You should.
Too, yeah.
Everybody should, because your chronic, nobody knows what's going to happen day to day. And so I think hospice kind of pushes you to make it a priority, to think about those issues.
Well, I'll tell you this.
Tell me this.
If my heart goes out, I don't want to be resuscitated.
Okay.
But if my lungs go out, I want to be resuscitated.
Okay. You shouldn't be having this conversation at age 30, but we got to have it. You know that your heart is sick because of the muscular dystrophy and that it doesn't pump well. If your heart gets sicker, what I would recommend would be to not resuscitate in any form. Because there's nothing that can make that heart well again.
I usually talk to him about death and the DNR and things like that, but I'm basically waiting for him to make a decision on what he wants to do. I'm not going to push him into signing nothing.
Do you think Roger has a very good sense of what is going to happen to him?
Yeah. I think he does. But he's also told me many a times that he doesn't want me to worry, he doesn't want me to cry, he doesn't want me to be sad. He actually told us to have a party and turn on his favorite music, and I don't know that we will do that, but that's what he said.
Do you feel better?
I feel better because yesterday I went and got my shot.
Your labs are great. You look good. You're picking up a little weight. All right. Let's go to Wink. How are you doing?
Well, a whole lot better.
Better.
Yeah.
Are you taking that pill for nervousness and depression?
Yeah, is that for both?
It treats
Nerve
both.
pill and both
Yeah.
together. I told Patty I it probably was. You know, everything looked a little brighter.
That's good to
And
hear.
I mean, my mind, you know, working on things.
Yeah.
Get a lot of this here bad studying off my mind.
And I'm glad to see you smiling this time.
Thank you.
Oh, you're welcome.
Well, and good Lord up above us
Yeah.
here.
Mm-hmm.
I don't leave him out for nothing.
No, no. I was able to get Roger on hospice services. That has been fantastic.
They come in and they help me give Roger a bath, and Mia, the nurse, comes and evaluates everything, his skin and his medications and his food, and they're just all around good people.
He's kind of flirting with the hospice nurses in a good way.
They're really nice, and they make me laugh. So, I like it a lot.
How's your spirits?
Good?
You still sassy?
Yeah. More fancier.
You're all sassier.
I feel like my spirits are high. I have a lot of hope. I got a lot of strength. And a lot of love.
Gentleman didn't have his pants on. First go around. I work so many more hours now than I ever did. And these patients are truly my patients, that I'm responsible for them. And I do worry about these people. You know, there's a couple I called yesterday on my day off because I worry about them. And I don't think it's just me. I think a lot of the MD2 nurse practitioners feel like they're never off. I think it's a common feeling, and I don't know how to handle that better, or I'd like to find the NP that handles it better and talk to him or her. What I really want to happen is I want a magic fairy to do my grocery shopping tomorrow and plan all the meals for the week. Hello.
Hello.
How you doing, Louie?
I'm dead.
You're dead.
Yeah. This is more.
I've never heard someone speak from the grave.
Well, now you have.
I'm glad to see you.
I bet.
Tell me about your relationship with your brother, Louie.
He's recovering from a heart attack. I try not to hassle him, but he's Louis.
Good morning. Are you still half asleep?
Yeah.
I hear you got something going on with your toenails. They're not terrible, but they don't like you doing them yourself, huh? You have a clipper?
more.
Because I'm happy to cut them, I just need a clipper. Do you ever get out of the house, like to see a foot doctor?
No.
No. They're not too bad though, believe me. I've seen nails that haven't been clipped in years. Look at that. You're ready to model your sandals. You have one refill, a 90-day one on that, and another 90-day on that. So we're good for another about 4 months.
Okay.
Okay? All right, I'll see you next month.
Mine is screwed up.
Keep up the good work with your therapy and the stretching part. Look at you.
I tried.
I know you do. I'm glad to see you. I'll see you next month, okay?
I can wait.
Okay. Thanks, Ron. Talk to you next month.
Okay.
Alrighty. Bye, Louie.
Do you do refills on medicine?
For patients that are enrolled.
Oh.
His feeding tube is acting really strange. It used to be really tight up against his stomach, and then for some reason it's lifted like 2 inches. This morning all of his medicine came out, so he probably didn't get much of it.
That's really sore.
Mm-hmm.
So here's what I'm worried about, which is going to take precedence over all the other issues. I mean, you're not acutely ill, you know, but I'm worried that the leaking maybe has caused what's called peritonitis or an infection, you know, with the belly.
So I did okay giving
Yeah,
him that.
you didn't do anything. It might have helped his pain. It didn't hurt anything. A lot of what we decide to do is going to depend on what you're willing to do. I can't guarantee that you're not going to get really sick.
Oh, God.
Like what are they talking about?
Well, like overwhelming infection. So, the most cautious thing to do is to send you in. If there is infection, you'd get IV antibiotics.
And that means he'd be in the hospital for
A while. I know you're on hospice, and I know you're not interested in doing huge amounts of things to prolong your disease course. But I don't know if you're willing to risk letting this feeding tube malfunction, you know, be something that ultimately could take your life.
I'm not staying home if it's gonna kill me. I gotta leave.
Do you mind if I step outside and make a phone call to Dr. Jackson? And I want him to completely understand before we make this huge decision. The problem is that the ride in the ambulance is so traumatic for his breathing. Partially it's his anxiety, and partially it's just he can't breathe when all those factors don't line up for him, when his fan's not on him, when he's not on his particular BiPAP. He has to be in that one position to breathe.
Oh, dear Lord.
Hello. I need your advice on this one. He just had some water and it's coming right out. His belly's pretty tender everywhere. And he's afebrile, but I'm just worried that he's got, you know, some infection now going on. Is that reasonable to think? It's really loose. I mean, I'm not gonna tug on it too hard, but I can move it inches in and out. It's not sutured down anymore. His respiratory status is just so precarious that, you know, going in really shakes him up.
Don't have a choice.
Not really. Not right now, no. If his heart was a little sicker, you'd have a choice. But it's not.
I don't know what to do. I don't know to go to St. Mary's or go to Deaconess. I hate Deaconess. And the last time we went there, they asked me if I pulled his feeding tube out.
Oh, you're kidding me.
And then the doctor knew what happened. I was like, no, I didn't.
I think a lot of these people get judged when they go to get their medical care. There's a judgment call made about who they are, and I think care definitely suffers according to who the provider, whether it's a nurse practitioner or doctor, thinks the patient is. You know, and if they think they're a good person and they're educated, they get one type of care, and if they think they're poor and you know, maybe have had some trouble with the law, they get a different kind of care.
I don't think I did anything.
Of course you didn't, Shirley. Goodness me, is that what you're worrying about?
I just did what they told me.
Yeah, you did nothing. You absolutely did nothing.
But I want to know, I want them to give me a full report of why. Why it happened, because that doctor needs to be sued because Roger told him it wasn't right. You didn't listen. I have no reason to cry. Let's just do it and go do it.
Yep, just do it and get it done and come home. Maybe I'm completely wrong, and maybe they'll CT scan him and change the tube, and that'll be it. It's hard to know what's going to happen. I mean, that would be a best case scenario, and you'd get your tube changed and you'd be on your merry way. So I think we just have to take it step by step. I don't think, we just can't know until they look at that tube and either pull it and put a new one or do a CAT scan and see. Hi, this is Jess MacLeod. I'm a nurse practitioner with a home care patient. My patient, Roger Brown, has a feeding tube that's come loose, and he's stable, but he needs transport to the ER.
We have infection, and she don't want to treat it here.
If anything changes, you just let me know, okay? And we'll...
Thank you for your help.
Thank you. I think it went a little calmer than last time.
Hello?
Hey, Shirley.
Yeah.
It's Jess. I'm just calling for an update. How are you this morning?
All right. Well, last night they did the CAT scan.
Mm-hmm.
And the urologist came a while ago, and Roger has, she said both of his kidneys are full of kidney stones.
Okay.
And he has a 6-millimeter one right now that's in his ureter
Okay.
that we're waiting for him to pass.
Okay.
And the anesthesiologist came in, and him and the urologist both think it's too risky to put him under.
Okay.
Take the kidney stones out. So that he said he don't want to do it unless it's a life or death situation.
Okay.
And feeding tube, they put a temporary one in last night, like I told you.
Yeah.
But the nurse had put medicine in there, and all of it just ran right back out of the stomach.
Oh, really?
Yeah. So we're still waiting for a GI doctor to come.
Okay.
And tell us what to do
What
about
to
that.
do. So, but he is going to get to see a GI doctor.
Yeah.
Thank goodness. That's really what I wanted. All righty.
Yeah.
Well, sounds like he's in good hands. Give him my best.
Okay.
And keep me posted if you think of it. But I'll probably call you tomorrow too.
Okay.
All right. I'm glad it's getting taken care of.
Okay.
All right. Talk to you later.
All right.
All right. Bye.
Bye.
It's been kind of rough going through all this. Again, I've been getting chaplains to come up here, and they've been praying for me a lot. And I used to not believe in prayer and all that, but now, ever since I got worse, I tend to believe more. I think it's just a sign from God that I'm going to be all right, as long as I try to believe that there is a higher power and that He does help. At least He tries.
Yeah, the feeding tube's good. We're just worried about the stones that he's got to pass. And so we're going to go home, and hospice is going to come back, and we'll start all over again.
Okay, so this morning I was asleep, and at about 6 a.m. the phone rang, and I saw it was Shirley's number, and so I answered, and she said Roger had really taken a turn for the worse overnight. A lot of shortness of breath, a lot of nausea and dry heaving. And they had the hospice nurse out there who, recommended some nausea medicine and some pain medicine, but I could hear in her voice she really wanted me to come. So I said, you know what? I'll be there. I just got dressed, and so I got there, and it's pretty clear he's transitioning into death. And it's truly a process. I mean, it's the wildest thing to watch. It's a process of dying. Shirley knows it. She just needed me to say it. She said, is he? And I said, he is dying. And then she lost it. She absolutely lost it. She wailed. She's shaking. And it was a little bit of a surprise to me, because it was like she was completely unprepared for it. Emotionally, like your kid had been hit by a car and you just found out. Shirley and I just talked for a good hour and a half, and she told me, Roger's her best friend and she doesn't know what she'll do without him. And she's just not ready for him. She's not ready for him to die. Even though she was told, he won't live to see 20, and he's 30, she is not ready. So what was happening is I was on the porch. Shirley was smoking because she's been up all night. And I would just go in every 5 or 10 minutes to check on Roger and make sure he was okay. And I just put my hand on his chest to see if his chest was still rising and falling, and he opened his eyes. And he said, I love you. He did. And I said, I love you too. And he said, thank you. And I told him his mother was all right, because I think that's a huge concern for him, that she's going to be all right, and that she's going to be with him. We're right outside. And then he went back to sleep. He's a pretty special guy.
So what's next for you? Where do you go now?
So for me, I woke up at 6, and my daughter was mad at me because she said, you're not going to be back in time for my cello lesson. And I said, I will, I promise. And I'm not. So I'm going to meet her over at her cello lesson, and then we are going to go shopping for jeans. And then I promised Shirley that I'd go back this afternoon. But I promised my family other things too, so I hope they understand.
Okay. Good luck.
Thanks. Okay, so going back to see Roger, it's been about 3 or 4 hours since I've been there. Haven't heard from Shirley, which is probably good. I just want to keep Roger comfortable. I want to keep Shirley calm and just be there for them. That's all. Just want to keep checking in. Okay, I know where I am. It's a beautiful day. Family's there, that's good. And it's okay if he doesn't feel like eating. You know, if you don't want to do the tube feeds, just back off. I really felt this morning like anything could have happened. I mean, I felt like you could have died.
That's what I felt like.
Is that what you felt like?
Yeah.
You're different now, and it's so unpredictable. I feel right now like your body's getting tired. Do you feel that way?
Yep.
And so my goal and hospice's goal, what we want to do for you is to make sure that as you transition from this earth, that you're comfortable and your symptoms are controlled and that you're not scared.
I am.
Are you?
Yeah. Not scared of that, just scared of leaving my family behind.
I know your mom, she's gonna be okay.
Yeah. She's really, really strong.
She is. And it's okay for you when you're ready to go ahead and let go. I'm sure so many things are running through your head.
Everything. Because I do want to be woken back up.
And what do you mean by that?
Like, I guess resuscitated.
Resuscitating a heart that's functioning at 10% is not going to work.
I figured.
Yeah. I wish it were so different.
I just don't want to do something that makes it even worse.
Yeah, and that would make it worse.
Yeah. I don't need any more suffering.
You don't. CPR works when, you know, you have a healthy heart to begin with and you have someone who's not chronically ill. If you have a sick heart like he does because of the MD and his lungs the way they are, number one, it's not going to work. It's not going to bring him back and it's going to hurt him. And two, if it did bring him back, he would not be anything close to the person. He'd suffer so much brain injury that, and I don't want to be pessimistic, but I want to be realistic because in my mind, it would be a really kind of a cruel thing to do. Can't predict anything. Just be together, be close, and treat his symptoms. But he's good right now. You got a little break. Just call me with changes and we'll help you manage the symptoms, okay? You need to eat and drink and sleep too, okay? Because you're growing a baby. All right. Thanks, Shirley. I'll talk to you later. Hi, sorry it's so late. Now, did I hear, are you losing your benefits? What's going on? So how's that gonna affect you?
I don't know. My sister's helping me to get through this. I don't even know if y'all do this now, but it's the health market plan through midwives.
Okay.
It's the Obamacare thing.
Uh-huh.
We didn't know if y'all did Obamacare or not.
Yeah, what I'm gonna do is we have a social work department that knows all about the different insurances and that stuff. I'm gonna have them call you.
It's going to cost me $138 a month.
Okay. Because you're on Medicaid right now, but they said you make too much.
But
you don't have Medicare too?
No, not until I'm 65.
Okay. I have a very nosy question to ask you, and you don't have to tell me, but I am actually curious. What do they consider as too much income a month for Medicaid?
You got to make $1,305. That's their limit.
If you make over, as a couple, $1,300 a month.
So we went like 400 and something over.
Do you think you're going to be able to get by with that extra $130 a month for insurance?
Well, we're hoping so.
I think we can make it all right.
I think we'll make it okay.
Well, happy Thanksgiving to you, okay? I'll see you next time, okay?
All right.
Talk to you later. Bye, Wink.
Bye.
Be good.
Don't y'all eat too much turkey now.
I'm going to eat a lot.
Y'all be careful.
Well,
I will eat.
my daughter, she piles a plate that high.
She does.
Makes a big plate.
A big plate lasts us for 3-4 days.
So not a whole lot new has gone on since he was so sick that Saturday.
He did eat a couple of bites of mashed potatoes and gravy.
Excellent. How did that taste? Really thin?
Amazing.
You loved it. It was amazing. Yeah.
Yeah.
Good deal.
We all need to talk
We all need to talk.
about something
Okay.
that you got up a long time ago. That you talk about. You know, if I, die, or if I stop, I don't know if I want them to bring me back.
If you were to stop breathing, you don't know if you want them to bring you back.
Because I don't know what's going to happen.
Tell me what you're thinking.
I just think it'll put me in a lot of pain.
It'll put you what?
In a lot of pain.
You deserve me to just be really upfront and honest with you.
Yeah, I need that.
You need that. Your body is winding down.
Yeah, I know.
You know it, yeah.
I know it's going to happen.
Yeah. You know, to try to bring your heart back or try to bring your lungs back, it wouldn't work because of how sick your body has become with the muscular dystrophy. I want to be flippant and say it's natural, but it is. We're all headed there. Our bodies are all headed there one day at a time. None of us knows when or how.
Well, I don't know.
Yeah.
I don't want that at all.
You don't want to happen at all.
But it's going to.
Yeah.
Nothing I can.
It sucks. It's not just the breathing anymore. It's not just your respiratory function. It's also the heart muscle too. The heart muscle is just sick. And so the chances of you going onto a ventilator and getting better are really low. You'd go on the ventilator and you'd still pass away after all that. It's better to be at home. I hope I'm not being too judgy and telling you what to do. No. You tell me what you want to do, but
that's what I want to do.
Yeah, you need to pass away at home with the people that love you, not in some cold hospital bed. You're comfortable here. You got everybody you need. And the other thing is that when the time does come, you've got a team behind you who we're going to be with you. We're not going to abandon you. We're going to help your mom. I think you need to know that she's going to be okay.
Yeah.
And you need to know that she's going to be okay, and she needs to know that you're going to be okay.
It should be okay. They say that out there is a magical. magical place to be. It's okay.
I know, I know.
I know. Oh, your baby.
I know.
You're so good.
You're her baby.
I know.
Roger's just an amazing person.
He's incredible. I mean, I don't have words for it. I don't know that you do either.
I don't.
No. Yeah. All right. I better let her deliver. Will you call me if you need something? All right. I'll talk to you later. I barely really did a physical assessment. It's not about his physical health anymore. In terms of, there's no curing what's going on. So it's all about his emotions now and whether he's comfortable, and he is definitely declining. I felt like today was kind of poignant and sad because I feel like it's close. And what he said, I wish we could get that quote. He said, it's like fighting a battle every day that you're never going to win. And I can't even imagine what that must be like. So.
He can't cook, he can't boil water. And my God, they took his 2 meals a day and tore that down to 1. And now I gotta feed him the other meal. And what the hell? Why do I have to do that? So, they changed that part of the game, and now I'm supposed to cover his ass because he won't pull another penny out of his pocket because he's a tight ass. And I can either let him starve or feed him, so, you know better?
Was that a come in or don't come in?
No, you don't have to walk through.
Oh. Nice.
Pain and do shit about anything.
I thought the physical therapist was going to get you a new wheelchair.
I was thinking that too.
I need to check on that. Well, have you had any concerns since last time? Any coughs, colds, pains?
I've been healthy.
You've been healthy.
I believe so.
Good. Are you eating okay? Your appetite is as good as normal?
I hardly ever have enough to eat.
Okay. And when you say you never get enough to eat, do you just mean that you can eat and eat and eat? There's enough food. Is there enough food?
Yeah.
I'm just trying to understand the meaning of that.
I just eat like crazy.
Okay. It's not fair. You stay so slim. You can eat whatever you want and still stay that slim.
That goes back to my training as
An athlete. Your training as an athlete.
Wrestler.
Wrestler. Were you pretty good? Did you win your events?
I did get a trophy for the most pins.
The most pins. Dang. Thank you. See you next month. So sweet. Thank you. I'll talk to you later.
Can I have a free pick in your brain?
A free what?
A free pick in your brain?
Sure.
He has somebody else that does his financial end, and for some reason he called my dead brother's ex-wife because, you know, he is himself, and the next thing I know is I'm a third-rate citizen. You know, I have no pull over. You know, I've been his mama brother for 40, 50 years, and here we go. And the next thing I know is that the bird flying down the street has more power than I do, because at least it can shit on you and get away with it.
Yeah.
And when somebody can come up and tell me I got to move out of a house I was born in, because they got some kind of signature from somewhere else, and this man has no clue. Screw that. The truth is that if I wasn't here, it'd be a nursing home. So I have to go to court and become his, legal, whatever, some kind of mother, brother,
Well,
officially? Or...
even though he's got some immobility, he's of completely sound mind.
No, he's not.
I think a judge would probably say he was.
I'm sorry, but people that don't deal with it for 13 years walk in and say,
All I know is that I take care of his primary health care needs.
Right. And somehow the flow of what you do, you have I guess a drifting effect that you don't know about.
That could be.
Somebody does have to have a foot on him, and yet it's a free moving foot. I give him lots of float room, and I don't use that unless I have to. But now,
Bye, Ron.
you blink and life changes. Well, okay, I guess I'll do some creative lawyering.
Yeah, that sounds like you might need to contact a lawyer.
I'll call in something that you don't want to happen to you. Because everybody has their little kinks that you can hurt with. And,
Well, now that's kind of making me concerned when you say something like that.
hey, if I have to tell this judge that I'll put you out on the street, and or whatever, I'll do what I got to do.
Who are you talking about?
I'm talking about care for him. I'm still his mother, brother, and I'm going to stand where I am because I know what my mother taught me to do. And if he's pissed at me, so be it. I will still stand where I have to be. Okie doke, I'll do what I gotta do. I mean, that's just a pain in the ass.
Do you feel safe and protected?
Yeah. am still, I think, a wrestler, and I think I can put you in a guillotine.
In a guillotine? Is that what you said?
You scream for help.
Okay. I think there's a lot of financial issues and who is in control of the money. I think Louis feels like since he has taken care of him since his mother died, that he probably deserves some of Ron's money. I wanted to ask him, oh, you're his mother, brother? What do you do for him? Because Ron, toilets himself. He gets a bath aid a couple times a week. He's pretty self-sufficient. If things are sketchy, I really am beholden to call Adult Protective Services, and they'll investigate and make sure that he's safe and nobody's taking advantage of him. Patricia changed her plan to be able to get more affordable medicines, I think, And in doing so, we don't take her plan. MD2 does not take her plan. So she had to get a different primary care provider.
Yeah, she finally got her insurance through. They sent her a card.
Okay, good.
Yeah.
So she's seeing another doctor now.
Yeah, she went to it the other day. Well, she's a woman doctor. Over here on Franklin Street over here.
Yep.
I can't think of her name.
How are your spirits? You seem pretty good.
Yeah, I've been doing fine.
Enjoying the fall and enjoying Thanksgiving time?
Yeah, I had plenty of Thanksgiving.
You did?
Yeah.
Good for you.
I'm just be glad to see summer get here again.
Well, I'm going to send the lab out here to get your lab work. That's your prescription.
Okay.
Because you'll need that. Here they come.
Yeah, here they come.
Mm-hmm. Here we are. Hi! Surprise! How are you doing?
I could say I'm half and half.
You're half and half?
Yeah.
All right. Well, we're just wrapping up, Patty.
A while back, my people from the church come over here and prayed for me and put his hand on my stomach. My stomach was hurting, burning. It does that sometimes. And first thing you know, boy, he just went away.
That is amazing.
Didn't he, Patty?
Yeah.
Mm-hmm. How are you doing, little lady?
You know the last time?
I'm hanging in there.
You know the last
But
time
I
y'all
got
was at?
that Dr. Christina Gerlin up here at Dr. Webb's office. No pain doctor. She won't prescribe no pain medicine.
No
at
pain
all.
meds.
Mm-mm.
He had a bunch of mucus caught in his chest, and it was blocking his airway, and he totally passed out and was blue, and he couldn't breathe. And so I hurried up and got the morphine and gave him some of that.
The on-call nurse was called. His stats were down into the 50s. He had turned blue up through both of his arms, his chest. He was incoherent. The family panicked and called 911. And then when they got there, they couldn't find the DNR. And, with emergency personnel, they're required to do CPR without a DNR in the home. So unfortunate that they were struggling to find it.
They wanted to know if Roger wanted to go to the hospital. And I said, well, I don't know, I can't, he's not responding, so I can't ask him. So they waited around, and finally Roger came to, and they asked him, he said, no, I don't want to go to the hospital.
Something that the on-call hospice nurse said to me was, he used to be an ICU nurse, and he said sometimes when someone was in a situation like that, we over-treated them and made it worse. People jumping in and doing things, and he said it was very interesting for him to watch, because his body took care of it.
Yeah.
It took a little bit, but left with some very gentle support, his body took care of it. And I think at this stage of his life, letting his body do what it needs to do, either to come out of a situation or to let go. And his body's the only thing that knows which way that's gonna go. I'm glad he's better. Yeah, he seems it. His Hello, good morning.
Good morning.
How are you guys?
Oh, hanging in there.
Hanging in there. Nice to see you, Pat.
Yes.
It's been a little
A
while.
lot better to see you walk in the door.
I'm glad to see you. Let's talk
I'm glad
first.
to see you.
And then we'll kind of talk about your stuff. How you been?
Hanging in there.
Hanging in. So you're coming back to me.
I sure am. And
What
I'm happy.
You're happy. What
Yes.
happened?
Well, we had this one insurance that dumped me,
Yep.
and then now I got the United Healthcare now. So
Okay.
I got you.
So did you, when you changed insurance and you went to another provider?
Doctor.
What happened?
I don't know. They didn't take the insurance no more.
Oh, they didn't take your insurance anymore. Did you ever get to see that person?
One time?
Just one time?
Yeah.
Is it a better insurance for you covering medicines and covering stuff?
Yeah.
So that's why you switched to it?
Uh-huh.
Okay.
It's like a silver plan.
A silver plan?
Mm-hmm.
Okay.
But it's a good plan.
Good. Well, I'm
I
glad.
might have to pay for it, but it's good.
You pay for it?
$236 is almost $237
a month.
Yeah.
How's your sugar been running? Because it was getting low there for a while.
Well, it's been real good. It's been like 120, 125, 130.
Perfect.
You know, she didn't been doing pretty good.
Did that doctor do any lab work on you when you were there that day?
Yeah, they said my sugar was down.
Uh-huh.
And everything.
Yep.
And he said, start eating sweets and stuff like that. Bring your sugar up.
Okay.
I said, well, heck. I eat my food. I don't eat
You have a
that
good
much.
appetite.
I've been getting a good appetite, honey. I bought 4 slabs of ribs and cut them up and put them in the freezer and have baked potatoes and ribs.
You're a good woman. I bet Wink likes that. All right, I'll see you guys in a month. It's so good to see you.
I'm glad to be back.
Oh, me
man.
too. Is he getting any feeds or?
Yeah, I'm still feeding him, and he's still going to the bathroom. And this morning when Mia came earlier, he had wet the bed.
Okay. And that's unusual for him, yeah. Because he's not fully aware of what his body's doing. You know, his brain is just not functioning like it was, you know, even 2 weeks ago, so.
And he does sleep a lot.
Sleepy a lot.
And I heard him last night talking, but he wasn't talking to me.
You're fair. You having any pain? No. Okay. He's definitely declined a lot. Yeah. Yeah. He can still hear everything that you're doing and talking about, so he can, even if he's not, you know, awake and wanting to see the baby, I'm sure he still loves to listen and hear everything going. So people hear right up until the last minute before they die, so keep talking to him and loving on him.
But it's coming.
It's coming. And then he can really rest. Yeah. He's been a huge fighter. I mean, he's fought and fought and fought and fought. Yeah. What can I do for you?
I don't think anything.
Okay, just be in touch. Just be in touch. I'll check in next week again. And you've got all our numbers and just, well, I don't have any advice. I don't know. Just be you. You're doing great. Okay. Call me if you need something. All right. Happy Valentine's Day. Thank you. Enjoy that sweet baby.
The Indiana Department of Transportation is saying it's deployed more than 300 of its yellow plow trucks on snowy highways in southern and central Indiana.
So the last time I saw Ron, I was worried because Louis was talking about he was gonna, go to his lawyer and get the money from Ron, and I was worried that I just needed to make sure that Ron was financially protected from Louis. So I called his caseworker, who called me back and reassured me that he has a financial power of attorney. It's a family friend who is legitimate and caring and protects the money, so Louis cannot get his hands on it. And they've been down this road over and over again with Louis, who feels like he deserves some kind of financial compensation for, quote, taking care of Ron, end quote. We agreed that we would just continue to keep monitoring the situation, so he's protected financially. We'll just make sure that he's not being too mean to Ron, and definitely, of course, anything physical will act on. But right now, it's two brothers who fight. Whenever he's feeling like he's just air hungry like that, that's the time for morphine. It's coming, babe. I'm happy to do it, but he's probably wanting you to do it.
I do too. Sit under there.
Get your fans on you, okay? I know, honey, I know. You think you can rest now? Okay. All right, baby, I love you, and I'll see you in a couple days. So I guess they had a good night last night and stayed up till about 3 in the morning talking, and he was comfortable. And they went to bed and she fell asleep, and when she woke up at 11 this morning, he was gone. Yesterday was a really tough day, and he was really, really struggling. And it sounds like maybe the last part of his life was a little bit more peaceful. I'm gonna head over there and just pay my condolences. I just want her to know that I care about them, and I care about her, and I care what happens to her, and that I was glad to be part of their life. That's what I want her to know. I think this kind of a service means so much to families. When you go to someone's house to see them, you're telling them, I value you enough as a person to come see you where you are. Oh, sorry. It's not spoken, nobody talks about it. But I think these people feel like I'm kind of special, you know, they're coming to see me, or at least Someone cares. Lily?
Yeah.
Lily, it's Jessica from MD2U.
Okay.
Hey, sweetheart, how are you? Sorry to wake you up.
That's okay.
It's just so cold out there. Oh my gosh. How you been? Tell me about your hospital stay.
Well, I went in for...
Look down your throat. See what's going on.
I know my head's holler.
You never aggravate me. So you probably need a refill on your pain pills. Yes.
Keep on trucking.
I know you keep on trucking. So I think ultimately the solution is there needs to be more people doing this. More, and not just nurse practitioners, there needs to be more caregivers, more aides, just more people need to help these families.